Hello and assalamu alaikum, everyone. Welcome to another episode of the Young Thinkers Gloucester podcast series. And for those who haven't seen the series yet, we'll introduce ourselves. I'm Omar Javid. I'm an orthopedic surgeon and co-founder of Young Thinkers Gloucester, a non-profit organization that helps with health and education topics in the community.
And I'm Dr. Kasim Javid, a GP registrar, also co-founder of Young Thinkers Gloucester. You may have also seen me on some of the podcast episodes, as well as my brother here, although we've never actually featured on an episode together. So this is a unique episode, and we're quite looking forward to talking about Ramadan, to sort of maximize your Ramadan from a health perspective, to enable you to have the best spiritual Ramadan as well. This is aimed mainly at our Muslim viewers in terms of looking after your health, but certainly it has a lot of relevance for healthcare professionals who might be also looking after patients with Ramadan and fasting and how to maximize things.
Yeah, and the way we were thinking of doing it was to go through some of the common problems that people have and health problems that people struggle with during Ramadan, and then some of the specific health conditions and ways in which to manage those. So we'll just kick straight off then. I think one of the common things people talk about and that they struggle with during Ramadan is dehydration and tiredness. So what's your experience of that personally, and then what would you recommend?
Yeah, absolutely. And I think it probably was a little bit harder when we had our summer months, Ramadan, and things are slightly easing off now that we're going into March and things. Certainly, not drinking enough. I think particularly sometimes people worry in the night time they might have to be rushing to the toilet and things like that. But at the same time, we know even on average days, we should be targeting sort of 1.5 to 2 liters, or think that as like 6 to 8 glasses or 6 to 8 cups. So really, during Ramadan, there is that drive still, and in the non-fasting hours, we should be thinking about trying to hit those targets as well. And I suppose there's things we should probably be avoiding from a dehydration perspective as well.
Yeah, I think obviously caffeinated drinks we should be careful with, so coffees and teas, which we all enjoy, and it's worth cutting down on those. We'll touch a little bit about that later on. And then I think it's important to try, apart from drinking the water, which we know is important, but we can even get some of that hydration from the food we eat, so fruit and veg, which are water containing. I think, such as cucumber, courgettes, watermelons, and so on. Trying to have some of those to keep hydrated as well. Soup is again a good source of fluid, and it's quite healthy, and that will also keep you full for longer. So these kind of ways from getting your hydration from the food is also beneficial.
Absolutely, and I think salt is another one which we probably underestimate in the sense there's the obvious salt that you're literally putting in terms of your food or in your cooking, and then there's the hidden salt, which is those processed foods or packaged foods, which actually in the actual recipes and the way they make them, they're incorporating a lot of salt into that, and that just dehydrates you. So going back to basics, eating real foods where you know the ingredients, avoiding the processed packaged stuff, and then trying to just limit the amount of salt that you're physically adding to your own food, to avoid that dehydration component.
I think, as you mentioned as well, it's perhaps a bit easier, inshallah, this year compared to previous years. With in the past, it was a summer month and longer hours. I remember we used to play cricket, our cricket team, and we used to fast during the cricket match and so on in the heat. So um, it is manageable. We just have to be sensible, and we have to just keep hydrated. And rather than having fizzy drinks or concentrated juices and so on, we should try and maximize the water that we're having during those hours.
Absolutely. I think that almost will help with some of the other problems we're going to be talking about as well. So, thinking about, for example, reflux or acid, hydration will help with that problem. And some of the things you were just mentioning about things to avoid, so caffeine, fizzy drinks, salty foods, we know all of these actually contribute to acid reflux type symptoms, that indigestion you might get, particularly after breaking the fast a bit too quickly, getting a bit too excited maybe with some of the fried foods and things. That kind of thing will cause you more discomfort, and it's probably going to impact your night of sleep as well. So they definitely overlap some of these healthier living choices you can make.
Yeah, I think we all sometimes enjoy our fried food and things, especially in Ramadan. We have the cravings, but again, it's worth bearing in mind the reflux that you can get. So being sensible with that, and also the same sort of things can increase your stomach acid. So the coffees, the fizzy drinks, the fried food, these are all things that do increase your stomach acid. Spicy food, we do like spices again,
Yeah.
but again, having too much of those things all in one go and then going to sleep, for example, is just going to give you a lot of indigestion and heartburn.
And what I'd recommend, especially, is if you're someone who already suffers with heartburn, and this is maybe something you want to look at more detail, even beyond Ramadan. If you look at Patient UK and a reflux diet advice, they have a really comprehensive list of foods that we should be looking to avoid. So we certainly touched on some of those, but some of them you wouldn't have even expected. Things like chocolate, tomatoes, smoking, even these kind of things really do contribute to acid reflux, and so it is something that can be quite bothersome, especially in the evenings, and affect how your fast is going. So it might be worth looking into that.
And one of the good things about Ramadan is that it's a chance to build those healthy habits. If we struggle during the year to break those habits, this is the time to do it, inshallah. And doing it for 30 days, gives if you manage to get through 30 days and you've built that habit, then inshallah you'll be able to continue that later on as well.
Yeah, totally. And I think a brilliant way of doing it is, thinking this is sort of a 1 month period to make those good habits as well as try and reduce some of those bad habits. So doing things too suddenly, too quickly is always more challenging. But that sort of 1% or 2% change you can make each day, maybe it's just slightly reducing the amount of caffeine you have, changing that 1 cup to a decaf cup, trying to reduce the salt slowly, and doing it across the whole month. Inshallah, yeah, you'll get the benefits of that in the month, but then also beyond that.
And I mentioned tiredness. How would you tackle tiredness in Ramadan?
It is tricky. I suppose caffeine is playing a role there because the first week or so, especially if you're someone who's used to a lot of caffeine, I can definitely understand that struggle. I think the first week maybe it might come as a bit of a sort of difficult period for the body, but then as you're gradually weaning down off it and maybe exchanging your caffeinated drink to a decaffeinated drink, particularly at the iftar time, your body will start to adjust to that. So you can actually use that to build momentum into the final part. Maybe you're going just down to decaf drinks, and then it makes it much easier for when you can go beyond iftar without an actual caffeinated drink, and then you can use that beyond Ramadan as well. So that's the caffeine part. I don't know if you have anything else for
Yeah,
tiredness.
I think sleep, obviously, we know in the past, again, with the long hours of fast and then going to Tarawih, finishing late, being up early, it was a struggle. It should get a bit easier this year. I think with the timings, by the time Tarawih finishes, there's still a good amount of time in the evening. So getting, on average, 7 to 9 hours of sleep for an adult is what's recommended on average. You should be able to get that at the night. Um, for those who are able to, or uh, you know, they can do then after Zuhr the recommended nap as well. If they have a shorter sleep time during the night, the afternoon nap again is useful. And trying not to overdo things during the day. So when you're fasting, you want to conserve your energy and not be burning off too many calories.
Yeah, absolutely, and it's doing whatever's you're able to in your means, because at the end of the day, you're still fasting for a greater purpose, and so if you're physically healthy, that will enable you to make the most of things from your own religious aspect as well.
Yeah, I think in terms of other struggles that people mention, obviously weight, either gaining too
Mm.
much weight or losing too much weight. What's it been like for you
Um, I
in the
suppose
past?
yeah, maybe the negative side of things. Being honest, I think yeah, it's a good opportunity, isn't it? Because you can actually see there's a shorter window of eating hours, and we know that fasting naturally does have a lot of benefits to improve your weight control. But unfortunately, probably what we do, human instinct is we just eat the same amount, or if not more, during that small window. And it's just almost a simple game of calories, really, in that sense, that you shouldn't really be packing in the same number of calories or an excess of calories in that sort of small window between sunset to sunrise, but naturally we all get, eager. We see the iftar, we smell the iftar, and then we go harder than we probably should.
Mm. Yeah, I think again the strategies for people who do put on too much weight are some of the things we've mentioned about avoiding fried food and sugary foods. And at iftar time, there are two types of people really. One who like to eat their full iftar and then pray Maghrib after, or those who have a little bit and then pray Maghrib, then go back and eat a little bit more. I think the benefit of the second way of doing things is that you have that little delay, so you break your fast with some dates and water and so on and some fruit, and then you go for Maghrib, and then when you're back, you're a bit ready to just have a normal meal. Whereas I find that if you're eating it straight away,
Yeah,
you sometimes
overdo it,
you
don't you?
overdo things because you've been waiting for that moment,
Mhm.
and the moment is here, and then you just go for it. All the food is there.
Yeah.
So that's probably one thing to be aware of.
And I think even in that regard, with that time period, there's other things you can do as well. So using it to your advantage that the iftar is now a fair bit earlier than the days of 9 p.m. and things like that. So you've still got a good amount of time. So physically speaking, you can still get some movement in, some light exercise if you're able to. So for some of our younger viewers, maybe that's actually more vigorous exercise. But even other viewers who are not exercising vigorously, light walks and things like that. I was speaking to one of our local GPs, Dr. Sam Kwok, recently, and actually we know that even a sort of 20-minute or 25-minute walk post eating has been shown to have really good effects on the glucose control, your sugar levels immediately after eating, and it gives it a much more natural incline rather than a sudden spike. So now that we have a earlier iftar, we can use that to our advantage. Perhaps you're actually someone who's fortunate enough to live walking distance to the masjid, or it's around the corner. Maybe taking that walk instead, rather than sort of getting in the car, although it's tempting. Just to see if in your non-fasting hours, you can still find ways to um, maneuver the calories and things.
Yeah, and you mentioned the glucose and going back to the sort of slow release and long release, uh, slow release and fast release carbohydrates. Which types of carbohydrates should you be avoiding, and which ones should you be trying to intake during Ramadan?
Yeah, that's a really good point. I think so. You'll see sometimes on labels or even online glycemic index. So the low glycemic index is the slow release, and that can be really beneficial for fasting, particularly in sahur. If you think about foods like porridge and oats, which keep your blood sugars stable throughout the day, and if you compare that to something sort of fast release or high glycemic index, something like just pure white toast or something like that, where you might get a quick sugar hit and it'll sort of give you energy quite quickly, but in terms of the rest of the day, it's going to slow down. Then really you can see the benefits of going for the slower release side of things.
Yeah, I think that's great. I think in terms of sugar and diabetes now, maybe you can give some more specific advice to people with diabetes.
Yeah, absolutely. So I think it's unfortunately a big one, and it's important because it's unfortunately very relevant for many of us. We probably know someone, or even have family members, or even ourselves have diabetes. So really, we have to think about fundamentally what is diabetes related to, and it's the sugars and not being able to your body not being able to control them very well. So I suppose from the outset, I would probably say we should talk about the times when we should be really careful and worried with relations to fasting. And that's, I think most patients with diabetes would know, is signs of low glucose or something like hypoglycemia. And that's where you can become quite sort of jittery, shaky, slowed, maybe dizzy, and maybe even some people can become more sleepy in that event. Those are signs that particularly people with insulin or things like that might have even experienced. And certainly if they have a blood glucose meter at home, that would mean anything below 4. that would really be a time to break the fast. And actually, the advice from guidelines, so we refer often to the British Islamic Medical Association, BEMA, and their guidelines, as well as the International Diabetes Foundation. Really, if you've had a severe low blood glucose attack or a hypoglycemia attack, it's advisable to actually avoid fasting until your diabetes is well under control. And the other flip side of things that people don't always think about is dangerously high blood sugars, and I think that's similar in the sense that we should be concerned about that. You might get excessive thirst, vomiting, sort of tummy pains, and cramps, and again, those kind of signs are a sign not to fast, or certainly to break your fast and really get medical attention. That's probably the emergency stuff. There's other things more regularly in terms of diabetes, and I suppose there's quite common medications that you might have in mind in terms of what people are regularly taking with diabetes.
Yeah, so I think it's important to mention for those on insulin or who have poorly controlled diabetes, then you should actually discuss it with your GP, and they'll be able to look at your diabetes control and help you there. But for those who have well-controlled diabetes, it isn't to say that they can't fast in Ramadan. I think you can if you're sensible, and you might need to make some adjustments to your medication, which we'll come on to. Um, but the other thing to mention is for people who are family members or looking after others who have diabetes, I think you can look at those signs that we've mentioned, so altered behavior or drowsiness and so on. And if you do recognize any of those signs, then you do need to check their blood sugars at home. So for others, particularly those who are on metformin, what's the advice that you give them?
Yeah, so metformin is the most common medication that many people will be on. It's the first medication they'll be started on with a diagnosis of diabetes. It's actually fairly safe to use in the sense of Ramadan and fasting. With people who are on the 3 times a day type prescriptions, the consensus now is actually that if you are normally having it sort of morning, afternoon, and evening, you can pair up the afternoon and evening dose at the iftar time. So you have the dose at suhoor, sehri, and then fast your day, iftar time. You pair up and put the 2 doses together for the iftar time, and that's been shown fairly safe, as well as prolonged release medication. So some people are on modified release metformin. You can normally just go alongside the suhoor and iftar times for the twice daily. And metformin doesn't really have that risk that some of the other medications like insulin or gliclazide might have, where you can actually, significantly lower the blood glucose. So that's a fairly standard side of things. Of course, with any medical condition, and if you particularly have concerns or things aren't well controlled, it's absolutely always worth speaking to your normal clinician who's looking after you, whether that's your GP, your diabetic nurse, or perhaps for some of our patients in the community where it's managed at hospital by an endocrinologist, having those conversations to get a little bit more specific advice, I would say.
Again, moving on to people who have high blood pressure and perhaps are on medication to treat their hypertension. There's sort of advice we can give to people about their medication, and also we would recommend monitoring your blood pressure at home. Obviously, you can get machines that can do this automatically, and if you do have any low readings, then it's time to be careful. And this can happen because of the dehydration that we mentioned already. So people with medications such as ramipril and amlodipine and other antihypertensives do need to be aware of the chance of low blood pressure.
Yeah, absolutely. It's all those things, slightly similar to what we were talking about before, but dizziness, feeling faint, lightheaded, um, fatigued, especially more so than normal. Especially if you have a meter at home, just check your blood pressure. And similarly, if a family member is able to help you, but that's probably if you are symptomatic, so you're getting symptoms of low blood pressure, and that's confirmed with your blood pressure meter, then that's a time to actually just break the fast, hydrate yourself, lift your legs up, especially if you're very sort of low and very sort of dizzy. and then just reevaluating things. We know some of the blood pressure medications can lower, so particularly the diuretic ones, you'd have to be more careful with, and those are things like the furosemide, thiazides, indapamide. I would probably recommend with diuretics, where they're working pretty much to release fluid from your body, and they work by that. That's where you should have a conversation with your usual doctor just about whether we can change things during your fasting time, because they're more likely to dehydrate you quickly.
Yeah, I think important things to look out for again is how much urine you're producing, what color the urine is. If you're really not producing much urine, and the other symptoms that you've mentioned there, so getting up, feeling dizzy, having problems with your balance, and so on, you do need to check your blood pressure. Keep a machine at home, and if it's particularly low, then it's the time to break the fast and hydrate yourself. So then the next thing that we could also discuss is people who have respiratory disease, so asthma, COPD, and specifically talking about inhalers and nebulizers. So we know that inhalers and nebulizers do break the fast.
Yeah.
So what's the sort of recommendation for people with these conditions?
Yeah, so I think uh, people who can fast with relative ease are people who are really well controlled. They might have asthma and COPD as a diagnosis somewhere, but they essentially don't really use their reliever, their sort of emergency inhaler, the blue inhaler it's commonly used. They don't use that very often at all, certainly not daily as a normal sort of thing. Um, it's fairly straightforward for them to fast in that sense. Uh, if you're someone who's regularly using that reliever, it might be worth reconsidering or discussing further with your asthma COPD nurse or doctor. In terms of inhalers, they do break the fast. You can have an option still. So people who are on the prevention regimes, like a brown inhaler or something where you're using it twice a day, they're still fairly safe to use in the sahur and iftar periods. Ideally, we need to keep them about 6 hours apart, which thankfully now with the days of fasting being slightly shorter, you can actually do that 6 hours apart. Um, if you're finding that the asthma or COPD control isn't really going as well, or you're needing the reliever, you're having to break fast, it's worth speaking to your surgery and your doctor or nurse about whether once daily preparation could be used for you, so once daily prevention therapy, because there are those options that you can take at Sari, and they're potentially stronger as well.
Yeah, again, important to mention that in those who have poorly controlled asthma or COPD, you need to discuss it with your GP. And for those who have health conditions or who aren't well controlled with their diabetes or asthma and so on, you do have a dispensation and you are allowed not to fast. And there are other means of earning reward in Ramadan, inshallah.
Yeah, absolutely. And I think if you look at some of the guidance from the British Islamic Medical Association, they make some good recommendations that particularly those who are newly unwell or have a recent bout of illness, there's always you have to factor that in, and that's inshallah reversible. So later in the year when you need to make up your fast, that might be easier. Um, Whereas if it's a chronic sort of conditions, maybe speaking with your clinicians or your doctors about if there are ways you can make changes to your medications that will keep you safe during that. Always much more worth having the conversation with your doctor rather than being worried about your health, maybe causing problems, and then still fasting regardless and having some repercussions to that.
Yeah, so inshallah, everyone has a healthy and productive Ramadan. We need to all look after our health, and by looking after our health, we can perform our good acts and deeds with more vigor and make the best of this opportunity. We managed to cover some of the common struggles that people have during Ramadan and how to approach those. We've also covered some specific health conditions like diabetes, high blood pressure, and asthma and COPD. And hopefully that's been a useful discussion.
Yeah, I hope so, inshallah.
Thanks again, and subscribe to our channel, and we'll bring you some more episodes. And hope everyone has a nice Ramadan.
Thanks for watching.